Wonderful. Welcome, Trina and Natalie, Jessica, Glenda, Brenna. Thank you guys for being here. We'll give folks about 30 more seconds to join, and then we're going to go ahead and get started. We have a full agenda as always, and excited to share some good updates for today. Wonderful. All right. Thank you. So we're going to go ahead and get started. It's great to see you all. I feel like it's been a minute since we did not have our September working group, so I'm thrilled to be back and to see everyone here. I'm actually coming to you from Washington, D.C., where I had the pleasure of speaking with a number of state legislators from across the country this morning about Medicaid policy. And I'm excited to share that folks were really thrilled to hear about our specialty plan and are eagerly following how we're transforming our system to try to learn from what we're doing, which feels exciting. And I'm doing my best to get all the tips and tricks from other states as well. So really thankful for this conversation today. We'll be spending some time on our August updates. It's been an eventful 2 months here in the past 2 months, so I want to share some updates from our end. I'm really excited for my colleague Michael to talk about a new Section 1115 waiver amendment, which is a nerdy Medicaid thing, but very important for our specialty plan, and excited to get your feedback on that. And then we'll spend most of our time today with our family and youth representative voices, sharing a little bit more about our September Care Coordination Summit, how that went, what we learned, and to get your feedback on how we'll incorporate those really important themes moving forward. So really thrilled to be back together. And with that, Mallory, we can move to the next slide. Roll call, as always, is in the chat. It's great to see folks adding their items. As a reminder, representatives, please add your name to the chat so we can mark you present. And with that, I'm going to turn to our updates since August. So as a reminder, this is a monthly working group, but we actually used our regular September time to meet with a smaller group of folks, which are our family and youth representatives, about care coordination. So since the full group has last met, I wanted to share a few updates. First is that we had our Care Coordination Summit. It was an excellent conversation. We'll be spending a lot of time on this and excited for this team to share more here, but a really crucial step forward, particularly timely given our work to develop and finalize the procurement for our specialty plan. So I want to thank all that joined and excited to get this full group's feedback today. Other fun update that happened since we last met was our Washoe County Youth Mental Health Summit that was put on by a number of excellent children's organizations here in Washoe County. And you'll see that the pictures on the right are some very fun fan pictures of Jessica Gogachia and Brenna, who are both our family and youth representatives who both presented and facilitated an excellent team panel at the summit. It was an excellent chance for folks to learn more about the work of this transformation, as well as our community partners more generally. And the youth on stage shared just some really special stories about how their lives are positively impacted by some community organizations. And it was just a really meaningful event. So I want to thank and shout out Jessica and Brenna. It was brave. I was a little nervous getting up on that stage, so I really commend you guys and thank you for all your work to spread the word in our community about this. The last win that I'm super excited to celebrate today is that we received approval from the federal government, from the Centers for Medicare and Medicaid Services, or CMS, for Medicaid in the state of Nevada to cover family and youth peer support. So this is something we shared in our September email update with the working group, but this is huge. This is the first of our home and community-based services that were approved by CMS. This is a really exciting step forward, and we want to commend our colleagues at Nevada PEP, as well as the folks at NAMI Nevada who helped us as well on the youth peer side. This is a product of months and months and truly years of hard work, and we're really, really thrilled for this step forward to take place. So what this means is people that are providing family and youth peer support in Nevada right now can enroll as a Medicaid provider and begin billing for those services all the way back to July 1st of this year. So really thrilled for this step forward. We're eagerly awaiting CMS approval for our rate updates, which will impact family and youth peer support as well. But the first of what we anticipate are many CMS approvals to come that we'll be celebrating with this group, and wanted to share that good news as well. Want to highlight a few other challenges that have happened in the past 2 months, because I know there have been many questions on these, and want to thank you all for your patience and support as we've navigated what was an unprecedented cyber attack here in the state. really proud to say we are back at 99.9% functionality here at Medicaid. Once besides the single day that all state offices were closed, our teams have been working full time to ensure that no service was interrupted for members or for providers. And they worked very hard and creatively to do so when we didn't have access to all the systems that we normally have. So excited to share that we are fully back and have been for a number of weeks, honestly. But if there's things that you're waiting on or that you need support with, again, we thank you for your patience, and please don't hesitate to bug us again in case that we missed an email or a Teams got lost in the shuffle. But truly appreciate all of your partnership as we navigated the situation. I also want to call out the broader context. As we know, the federal government is currently shut down as it relates to budget funding for this year. What this means in the Medicaid world, there's a lot of impacts I recognize, and our community in Nevada is feeling this in a lot of different ways. I want to reassure you that our Medicaid program is not impacted at this time. Medicaid is deemed to be an essential program, so our colleagues at CMS remain working as they normally are. We remain able to receive the standard funding. It is business as usual in the Medicaid world. I will acknowledge, though, there are some things that may slow down on our end as it relates to teams and work beyond just CMS, because other government colleagues are furloughed right now. And so we're continuing to navigate this and stay very close with our partners in the federal government, but I want to give you all that insight into what our world looks and feels like right now, because I recognize that there's a lot of uncertainty and there's a lot of change happening on a daily basis, and know that we are working hard to keep all of this work moving forward. CMS does remain reviewing our state plan amendments and our updates here as well, but some of those may be a bit slowed if they need input or support from other colleagues. So a lot of updates. It's been an eventful 2 months. If you have any questions on any of those, please don't hesitate to drop that in the chat here. I want to make sure that you all have the information you need as we go into October, which is hard to believe that we're already here. And I also want to do a special shout out. This marks 12 months, 1 year since this working group last kicked off, which is hard to believe. It's been a fast year and an amazing amount of work that's gone on. So I want to thank you all and excited to get into some of the work today. So with that, we can move to the next slide. And I'm thrilled to turn it over to my colleague, Michael Gordon, who's going to share a little bit more about our 1115 waiver amendment.
Yes, thank you, Ann. Good afternoon, everyone. Like Ann said, my name is Michael Gordon. I'm a Social Services Chief 3, mainly helping out with most aspects of the Children's Behavioral Health transformation. One of the most important things that I started out with was our 1115 waiver amendment. This waiver amendment is being hooked onto our 1115 SUD, OUD waiver that we already have going. So it helps us with a shorter process, I should say, versus a longer process of just starting all over with a brand new waiver. Next slide. So with waivers or with anything state plan and waivers, it is a very complex and intriguing process. So here, what you're seeing in the slide just shows you that it's going to take several pieces to put everything together for children's behavioral health. But the most important thing is that 1115 waiver amendment for the single specialty managed care plan. So we are already working with our federal partners, and we are also working with Mercer, who's a vendor for us, helping us guide through that process. We have posted everything for our single specialty managed care plan amendment out on our website, and I'll give that information towards the end of my slides. But it's out for public comment, and we're hopefully, I'm just going to give you a brief overview of our bigger PowerPoint that I've done for two public meetings that we've had so far. Next slide. So here, like I said, I'm just going to give you guys a couple of slides here. But obviously, the proposal is aligned with the administration's priorities to increase state flexibility in Medicaid, improve cost efficiency, strengthen managed care models, and expand access to community-based alternatives to institutional care. This PowerPoint will be posted, again, like I said, with the 1115 waiver amendment draft. So as you see on here, it's just really a big overview that we put out to our public so they can give us some comment. And next slide. So single specialty managed care will be well positioned to meet the accountability framework for the critical initiative to transform Nevada's children and youth behavioral health infrastructure. And again, those are our goals. So you see our accountability for the population, which most of you folks are very aware of already, and accountability as a risk-based entity. And we do, at this point, have a target population of about 20,000. And next slide. And then our objectives to provide child and family-centered care coordination practices for each member enrolled, which we'll be talking about a little bit more today. And objective 2, which is drive system efficiencies by reducing utilization of higher level of care. Again, a big overall objective of the Children's Behavioral Health. And next slide. And as I mentioned, we have everything posted out on, as Ann mentioned earlier, we had that cyber attack, which took our website down. So we actually, for transparency rules, we have everything posted on 2 websites right now. We started out with the OEM, which is the Office of Emergency Management. So we have oem.nv.gov, and on that site has all of our original stuff we posted prior to our first public meeting. Now everything has been duplicated on our, it's still a DHCFP website, but it's still converting to the Nevada Health Authority. So that's our waiver site right there. And under that waiver site, you'll see, as you scroll down, the 1115 waiver amendment for single specialty managed care. And on there, you'll see our full meeting agenda notice, full public notice, abbreviated notice, the amendment itself, which is the most important thing. And the original PowerPoint presentation I did to on our 2 public meetings that we had. We are taking public comment through October 18th, October 18th. And that can be posted at 1115 waivers at nvha.nv.gov. And if there is any questions, please go ahead and throw them in the chat for us. And we would be glad to take a look at those and add those to our public comment. And I'll hand it back to Ann. Thank you, Ann.
Thank you, Michael. I appreciate it. So for those that are newer to the 1115 process, you may be wondering, what are these numbers? What are all these complicated words and amendments? Michael, thank you for such a great overview of the purpose here. I think the bottom line is there's a lot of different permissions that we have to get from the federal government to make this transformation possible. And this is one of the first steps for the specialty plan. And this is required to go from as many vendors that meet our qualifications to a single vendor to provide that support across the state. And that's really crucial because we don't have enough kids in Nevada to have a whole host of health plans covering this. We believe that a single vendor is the right path, and that's what our settlement agreement holds us to as well. So this is a really crucial component. I want to thank Michael and his team for their hard work. So you can see from all these documents, this process is really complex. It is really meant to ensure that if we ever ask for permission to change the rules around this process, there's a lot of clear documentation of why. So we look forward to your feedback on those materials. And again, if you have any questions, don't hesitate to drop that in the chat here. So thank you, Michael. I really appreciate it. And with that, we will move forward to share a little bit more about our Youth and Family Summit. So as a reminder, this was what our September meeting was about, and we're excited to share a little bit more about that conversation. So for that background and to talk a little bit more about our lessons learned, I'm going to turn it over to Jessica.
All right, thank you, Ann. I am super excited. I'm going to just start out kind of with the context of sort of how we came here and what we sort of put in place for the Youth and Family Summit. And then I'm going to let Carly and Brenna sort of kind of do the meat and potatoes because they did so much of the work on gathering the youth and family voice and really doing a lot of the presentation of that part of it. And so as we have talked about in a lot of our other meetings, Nevada had the DOJ, we have the DOJ settlement agreement, which is requiring us to strengthen our care coordination services. And a big part of that is how we are supporting our youth with complex behavioral health needs. And so in September, we had a group of people with lived experience gathering and talking about the experience, going over a lot of the feedback that was gathered by Nevada PEP through focus groups, emails, surveys. We did send also an email link to the working group, also to try and help guide input. We did not receive a ton of feedback from that particular link, which is okay. We're going to have a little bit of conversation about that today as well. But we took some findings as well from statement of work and request proposals. And then we came up with some reflection questions, some guided input, and then some group recommendations sort of came out of that summit that we are going to present today and talk about, and then have a little bit of conversation with the rest of you today. And so I'm hopeful that Brenna and Carly will go through the next couple of slides with some of the specific feedback that was gathered from those focus groups and emails and from our summit.
Perfect. Thank you, Jessica. As Jessica said, we're going to go ahead and go through some of that feedback that we got from youth and families. This is a condensed version of what was presented at that summit of the feedback that we got from those various methods that Jessica outlined. So as far as the positives or what helps families and youth feel supported, families shared that feeling supported starts with being treated as true partners in their child's care. They want providers who listen actively, respond quickly to referrals, and follow through, not just give them a list. And they deeply valued professionals who take the time to explain things clearly and collaborate with them. Practical supports like help finding providers who accept their insurance, navigating school choices, and helping them with some of those additional things like applying for SSI made a big difference to families. And when it came to barriers, they very clearly described what those barriers were. They mentioned things like fragmented systems, long wait lists, and frequent staff turnover, and services that were either unavailable or located too far from their home. And this overall lack of services, and just to clarify, that was the services that would be coordinated, not the care coordination service itself. But that overall lack of services left families feeling like care coordination was more of a burden than a help. And a few families mentioned that they felt judged or misunderstood in their care coordination process. While families did overall have positive experiences with care coordination, they did express that in some cases, it felt like just another meeting and another care plan that wasn't really increasing their access to services or helping them get care for their child. And while they did value frequent communication, they felt that holding meetings just because it was a requirement when there wasn't really anything new to discuss was not helpful. And these challenges often left families feeling like they were coordinating care on their own. However, despite this, families did remain resilient and they were very clear about what works, which was respect, empathy, and meaningful partnerships.
Yes, and youth emphasized really that the support began with that clarity, knowing what services are available, how to access them, and they want one trusted adult to guide them through the process and keep them informed. And unlike families, youth focus more on that simplicity and emotional safety. They described the stress of having to repeat their story to multiple providers and the frustration of just poor communication between professionals. And some felt pressure to participate in services that they weren't ready for, which made them feel unheard. And I know me and Carly, we had a little bit more to add to this slide, so I'm going to pass it over to Carly.
Brenna. So when talking about who should be on the care coordination team, families wanted their team to reflect their real life support system. And they wanted to feel like they were the leaders, not just participants in the care. So they wanted that team to include providers, therapists, teachers, case managers, and family peer support specialists, plus any community or faith-based supports who truly knew and understood them. overall, they wanted teams that were collaborative, respectful, and centered on their strengths and values.
Yeah, and you've had a similar viewpoint, but they really just put more of a focus on their peers and friendships as those key supports. And they want care teams that mix professionals and those personal connections. So, like teachers, families, and friends, just to make sure that, everything is supported.
Yeah. When we talked to families about communication, they wanted to make sure that communication was flexible, transparent, and inclusive. They wanted to make sure that they were part of the primary conversation and not just updated after the fact. But one of the biggest things they stressed is that when it comes to communication, they want a choice. So some families preferred emails while others wanted text or in-person meetings. And they wanted the providers to collaborate with them, but also to respect their privacy and consent.
And youth definitely they wanted something more simple and direct. So with just one main contact keeping them informed. And it and make sure or sorry, I'm stumbling over my words today, but it just makes sure and making sure that providers are talking to them or talking to each other. They prefer updates by text or short calls and clear plans that they can follow easily. So just keeping them involved without overwhelming them.
Thanks, Brenna. And then the last thing that we talked to families and youth about was the guiding values for care coordination. And families overall emphasize values like respect, equity, inclusion, compassion, and trust. And they want their care coordination to be family centered, non judgmental, and empowering, and that their voice really matters.
Yeah, and youth focused, really they want to be listened to. They want to be respected and treated as individuals, and they want to be included in the planning of their care and to feel safe and empowered throughout that whole process. And some of the things that they brought up was having that choice, respect, safety, privacy, collaboration, cultural awareness, and the non-judgment. And I think we can go to the next slide.
All right. So across both groups, the message was really clear that care coordination must be built around the lived experience of the family. Families and youth are not just recipients of the services, they are experts in their own lives and should be treated as co-creators in the design of the care. And trust and transparency are essential. The communication should be flexible and tailored to the individual preferences, whether that's email, text, or in-person meetings. And systems need to be inclusive and responsive, recognizing the importance of both those formal supports and the family's informal supports, cultural responsiveness, and reducing stigma.
And kind of like I said before, youth especially wanted to feel safe, respected, and free from that judgment. Ultimately, meaningful care coordination is just about building those relationships, honoring voice and choice, and creating services that truly meet the needs that they were meant to serve. And I think I'm passing it back over to you, Anne, to expand a little bit more about the key takeaways and next step.
Absolutely. Thank you, Carly and Brenna. I want to first just spend a moment to appreciate all the time that you both took, as well as Jessica, in preparation for the summit. The number of folks that you spoke to, and I know covered some really sensitive and challenging topics with, takes a lot of effort, and the way that you handled that with such care and respect and appreciation for their experience is very clear in every conversation that you represent them in. So I want to thank you for that. And I want to thank you for such a thoughtful summary of those key recommendations today. So for those, as they've noted, what's really crucial about this is we're not just listening and saying, yes, that makes sense, right? All of these things I hope feel quite intuitive and do make sense to all of us that care about this transformation on the call. What's really important is how we actually apply that in our Medicaid policy and in the way that our specialty plan delivers services and our care management entities deliver those care coordination services. So really, I want it to be very clear just how seriously we take this feedback and how we've already incorporated some of these items, including that centralized provider directory and timely follow-up items in the contract for our specialty plan that we're developing as part of that request for proposal process. So really thankful for all of this timely conversation and work there. As well as your time and willingness to come on and share more about it with our group today. So want to share, again, those two takeaways to reinforce, first and foremost, care coordination is more than meetings and paperwork. It's truly coordinating services that meaningfully address youth and family need and what they are asking for in their support. And so building our care coordination separate than building our full continuum of behavioral health services that Medicaid covers and helping our provider workforce expand to meet that need. Those things we cannot separate them. They're deeply linked. And so I want to thank all of the folks that really continue to keep that front and center. And while we're focusing on care coordination today, know that we are not losing sight of this as something distinct and special by itself. It's really part of this broader context. The second piece is when we're building this care management program within the specialty plan, and for folks that joined us back in August, you'll have seen a little bit more about how that fits into the broader puzzle of this work. For those that weren't able to join, those are available on our website now, and we highly encourage you to take a look. We will have many more opportunities to discuss, and I'll talk on that in a second. What's really crucial is for this full program, we have to bridge all of the systems that are involved. We know that care management exists today across a number of our state agencies, our county partners, and our community agencies as well. And so finding a way to connect this, just to align and really consistently ensure that this is delivered in a way that meets our standards and best practices that we all are communicating and committing to here. And fundamentally, that this centers the lived experience of youth and their families and caregivers is crucial through all of this. So want to make sure that those takeaways and kind of recommendations are very clear here. We can always come back to the slide during our discussion if folks want to spend some more time on it. But I do also want to call out, if you're feeling like, oh, I wish I had more chance to dig into the details of what care coordination looks and feels like, you are in luck because we are going to be spending a lot of time developing our care coordination policy within our Medicaid service manual throughout the months ahead. And so we'll have public workshops and public hearings and a lot more opportunities for folks to be engaged in that process. So know that this is the first of many conversations to come. And the reason we had it first is because we believe that youth and family voice is fundamental to all of this. So with that, we're going to turn to our discussion here today and encourage folks to ask Carly and Brenna and Jessica questions as well on things that they heard in conversation or their reflections here. But for every member of our representative group, as well as our broader public community that's joining us today, we'd love to hear a little bit more. What are your takeaways from this initial feedback? Did any of this surprise you? How does this align with your experience, either as someone who's been part of our care coordination systems, or as a provider who's worked with care coordinators, or someone who has no experience but would like to? We'd love to hear from you. The second piece is, for those that are involved, how would you recommend that we include these guiding principles to inform your work or how care coordination is delivered going forward? So as we move into developing our Medicaid policy and working to embed this within that specialty plan that will again launch in 2027, how do you encourage us to consider that, and how do you view this feedback as relevant to your own work on a daily basis? So with that, I will go on mute, and I look forward to some feedback and to hear from you all. Actually, I'm seeing Trina's great question here in the chat, so we can maybe start there. Linking school services is critical. How would this look moving forward? Absolutely. Thank you for raising that. Absolutely, yes. Carly and Brenna, is there anything from our youth and family feedback in your preparatory discussions that you'd want to call out here? I remember you'd mentioned teachers obviously being someone that youth acknowledged as a key part of their kind of support system. But what else would you want to highlight as it relates to school services and care coordination?
Thanks, Anne. I was definitely wanted to mention that teachers, both parents and youth, mentioned that they wanted school professionals involved in their care coordination team. Families also mentioned that they appreciated help with accessing those school services. So Trina, I'm not 100% sure if your question is regarding like linking families to services at school or linking the school services with the rest of their care. Honestly, I feel like both of those are critical and definitely things that came up in discussions with families.
And one other piece I think that came up at the summit was keeping in mind then how do we schedule meetings, updates, all of those kinds of things that align with a working parent and also a school personnel's contract hours, which is always been a very interesting barrier, right? Because as Trina put in the chat, there is a disconnect often, because if we do it at a school and you have a working parent, then you're missing, right? Like a parent is having to miss work so that a teacher can be involved, or you're doing it, after hours, and then we're hoping that a teacher can come, but then they are doing that, on their own time, and that is asking a lot as well. And so I agree that has been a barrier for care coordination. I think even in the wraparound model, not care coordination, but the general wraparound model has been something that has been a challenge for always, but something to consider and keep in mind.
Yeah. No, thank you, Jessica, and thank you, Carly. I think that's spot on. The only other piece I'd add, I know we do have some colleagues from Nevada Department of Education and a number of leaders in our school health services community that are joining us on these calls. I think a number of them are actually all together in Philadelphia at a national conference right now too. So would love your feedback on how you all have worked with care coordination for kids that are involved in that right now. What are some good lessons learned? What can we improve? We'd love to hear from that as well. The other piece I'd add is here at Medicaid, school health service is a key area of focus for us to help our schools bill Medicaid for the services that they're already doing. We recognize there's excellent care that our kids are getting, especially within the realm of behavioral health in school settings, that they aren't always able to receive compensation for. And so we're working to help make that process to bill Medicaid and get that funding for services a little bit easier. We recognize it's not easy right now. So I think as that program is developed, it's going to be really crucial. And it's going to help us be able to connect those services into the broader care coordination service, because we're able to track what services are happening and really make sure that folks are getting connected to those services that are there. So thank you for flagging that, Trina. That's a great question, and welcome your continued feedback or ideas on how we can better improve that. Kenneth, yeah, go ahead.
Yeah. Okay. Well, my name's Ken McKay. I'm with Healthy Minds and have some experience in this area. And I wanted to bring up a couple of challenges that we've run into in the past, particularly with kids who are involved in the child welfare system. Those kiddos sometimes are not in agreement with who people have identified as their family. And it can especially be the case if the judge has decided that the permanency plan is no longer to be reunification. The kid's not always on board with that. And I think it's going to be really important to come to terms with a decision like that makes this treatment team have to not do what the kid wants to do. And sometimes that same thing is true even with like the foster parent will not be on the same page as the biological parent. And when the foster parent is supposed to be meeting with the biological parent to do reunification and the foster parent does not agree, and they will not come into the same room with one another. And I mean, so some of those challenges bring the question forward, care coordination for whom, right? And it's sometimes I can see care coordination efforts, there's a draw to circle the child with services. And if the permanency plan is to reunify with the parents, it's been our experience that who's the family? Is the family the child with the foster parent, the child with the case manager, the child with their biological family, or is it all of them? And where and how are services going to be wrapped? And it seems like those biological family members sometimes they get left out of that. I mean, we would start doing these care coordination or treatment team meetings, and the child has a whole bunch of representatives and all kinds of services wrapped around them. And if you say who's doing work with the parent, people don't even know. And so how we define family might differ from the case manager's point of view versus the child's point of view. And I think those are going to be some of the tough things to deal with as we move forward with in a new system like this.
Thank you, Kenneth. I really appreciate that. And I think that's spot on. Care coordination and a successful care coordination model that we're building towards is not going to be a single one size fits all version. It's going to have to look and feel different depending on the context and the lived environment that our kids are in. And so I really appreciate that. I think what's really clear in our settlement and in other locations, we're really called to include kind of natural supports of all kinds for our kids as part of this. And I recognize as you're raising these great examples, that can be quite complicated for kids that are involved in our child welfare system. And so I'd love to turn over to Brenna, who I see has her hand up, or Carly or others that were part of those conversations, as they did really seek out the voice of kids that have gone through the foster care system and may be able to speak to that. But I'd welcome Kenneth your input throughout the process to make sure the way we're designing our policy allows for some flexibility there that provides care coordination in support of the child and a successful placement in whatever natural support and family unit that shape takes longer term as well. So thank you for raising that. That's a great point. And Brenna, I'll turn it over to you there.
Yeah, I actually just wanted to share, we recently did the youth panel at the Family Wellness Summit, and a youth that has gone through the foster care system was on that panel. And I wanted to highlight something that they said about the fact that teachers didn't even know that they were in foster care, and just the need for that better communication with schools for youth in care or in foster communication across like agencies, just because shared a lot of her experience, and it was just so powerful, and in the eyes of her experience and as a youth just having to deal with so much, just that alone she highlighted as something that would have helped her when she was in school and in foster care. So I just wanted to share that because it was relevant to our conversation. Thank you.
That's a great addition. Thank you, Brenna. I appreciate that, and ties into Trina's comments on the school health services side as well. So before I go back to the chat, Karen, I'm seeing your hand up. I'll turn it over to you.
Yes, on question 2, I just wanted to throw out there that I hope that we'll be developing standards for care coordination, and the standards and principles will be the same, but the approaches may be different to meet the needs of the youth and the families.
Thank you, Karen. And I apologize, my audio cut out for a second. Can you restate the question there, or was it more of a statement in terms of how those guiding principles are involved? I apologize, my service is a little bit wonky.
Well, on question 2, I'm just thinking, how are we going to use these guiding principles to inform your work?
Yeah.
I think we need to have standards in place for care coordination.
Absolutely. Yeah.
That infuse the principles and the information that has been gathered.
Yes, absolutely. When you say standards for care coordination, are you imagining that as reflected in our Medicaid policy or in separate standards, or kind of where are you looking to that for?
It'd be great if there was like if it was in Medicaid policy standards, and then of course, additional evidence-based practices or additional standards could be in some other guidance, but there should be a bottom floor of what is required for care coordination.
Yes, absolutely. And that's really what we see the role of our Medicaid policy being, and that's what we plan to reflect there. So I look forward to your feedback as we craft that moving forward. I'll also note we have some of those core standards and values that we heard from that summit and from others, as well as kind of part of the broader values of the settlement and transformation reflected in that request for proposal that we're finalizing as well. So we plan to embed it within all aspects of our Medicaid aspect of care coordination, and we look forward to your feedback there. And Karen, if there's other opportunities to embed that, I definitely welcome your feedback there. I think that's really crucial. Thank you. I'm seeing some comments in the chat here, so I want to turn there. Want to thank I think it's Lee, for your feedback on the AAP recommendation regarding pediatricians' visits with older youth and early teens. I think it's a great suggestion, and I'd love to learn more about how AAP has approached this in other states and what those kind of funding models look like. So we will reach out to you, Lee. Thank you for sharing your email, and we'd definitely like to hear more about how our Medicaid policy could reflect that better. That's a really good point and something that I love to learn from. Trina, I'm seeing your questions here, or your comments on school health services and alignment with some FERPA, so privacy, school privacy laws and our health privacy laws. A lot of really crucial complexity there, and I appreciate you raising, how do we make sure our school staff know where to go when there's a crisis or a disciplinary situation or other more intense moments? How do they know where the help can be, and how can we pull in that care coordinator right then? I think it's a great point. I'd love your suggestions for how best we could do that. I think there's a lot we need to do just to make sure that our teachers are armed with the information they need to know who to call and how to get that support. But if you have other ideas on how we can best do it, particularly regarding navigating the complexity of those FERPA and HIPAA interactions, that's something our school health services team lives and breathes on a daily basis. We'd love to hear from you as well. So please don't hesitate to reach out over email on that piece or drop further comments in the chat. But I really appreciate that, and we'll note that feedback as well. I want to welcome Jess. Welcome to Nevada. We're glad you're here. I would love to hear your feedback on this piece, and we would look forward to a discussion about family and youth peer support. We've spent a lot of time learning from other states that have this right now, and have been learning with both Nevada-based organizations and also national organizations on how we can learn from that and continue to improve and reflect a Nevada-specific version. So that's what's in our policy and state plan right now, and we recognize we can always do more to continue to improve that and learn over time. So our team that's been working on our family and youth peer support will reach out to you over email, and look forward to hearing a little bit more about that feedback as well. So thank you, and welcome to our state. We're glad you're here. Trina, I'm seeing your comment about length of time for certification for PSS and the additional pay. Yeah, that's a great suggestion. I am not an expert on the way that this policy is written, but something I'm learning more about. So I'm going to have our team look into that. And if you'd be willing to drop your email in the chat, we can reach out to you with a bit more context there. I recognize that there is the additional trainings and support needed to equip our providers with the tools they need are costly, and it requires time taken away from clinical schedules. And so we're doing some thinking internally about how best we can reflect our reimbursement structure accordingly for those services, and we'd love your ideas. So would love to get that feedback, and please don't hesitate to reach out to us. And if you drop your email in the chat, we'll reach out to you first. That sounds great. Lots of great questions in the chat. I'm not seeing a name associated. My computer doesn't show that. Wonderful. Thanks, Trina. But B, thank you for the HIE piece. Crucial for eliminating duplication of documentation, allowing providers to see up-to-date medical records. And is there a plan to help providers, practitioners, and groups enroll in the HIE specific to behavioral health? Yes. I was actually just discussing this with a Medicaid director in Virginia and in North Carolina today. There's a lot of really complex federal laws regarding privacy specific to behavioral health, and particularly substance use disorder, which is part of our overall transformation here. And so we're really working to figure out how can we best navigate both meeting those regulatory standards and also, when appropriate, equipping our providers with the information that they need to best support our youth and families, and also prevent having to ask people to re-explain their story, which can include some really traumatic things. And so we appreciate the piece on the HIE. That is a component of our we expect of our specialty plan, and so a lot more information on that to come. But I definitely appreciate your focus on data sharing and documentation, and there's a lot of detail that we're already working through right now, even just to identify kids that will benefit from these services from our data. So definitely welcome ideas on how best to do it, but I really appreciate you raising that. That's a really key component of all of this. So thank you. I know it's a lot of me talking over comments. I'm really thankful for the comments, but if you want to share anything live, feel free to raise your hand, and I'm happy to turn to you as well. And thank you, Trina, for your email. Any other thoughts or feedback on the care coordination pieces? All right. Yeah, Dr. Cooper.
Hi there. So I am really excited about this. I'm thinking about the Healthy Nevada um, database, which I do recognize the complexity of sharing information and protecting privacy. And I think we have to balance that with the need of just making sure we get the necessary information to take care for the child and the family. And I really like the idea of kind of one database that has kind of the pertinent information that everyone kind of within the care coordination team can access. I think that eliminates or reduces the need for children to have to kind of re-traumatize by telling their story over again. Same thing for parents. So I do recognize the issues legally, from a federal standpoint of how do we capture and protect this data. But I think it's a pivotal piece in order for us to move forward. And I just have always found a lot of great outcomes coming from care coordination, a lot of which I do myself. Um, and I think it's important for us to reframe the stigma of, well, I'm not going to work harder than the patient, right? Or the patient has to call themselves, or here's a list of resources, and it's up to the patient or the family to, to make the calls themselves.
Yes.
We really have to think that this is part of the care that we're providing to the family. And behavioral health conditions by nature, there are lots of challenges with kind of just having to make the call. One, that it's terrifying, right, to reach out to a behavioral health provider, especially that first time. There's all sorts of stigma and assumptions that people have with that. There's kind of concerns about privacy. Um, there's concerns about being judged. Um, it's hard to navigate the system. Oftentimes people are not able to get someone, and then they leave a message, and then there's phone tag. So I'm super excited about this, and I think us really creating a system that makes it easier for families to access the care that they need is key. And I just wanted to echo the importance of school and really partnering with the school and making sure that they are a resource and that they're understanding what we're doing with the entire family, so that support and reinforce that work is great. And I think we're going to need to do Saturdays and Sundays and after hours because we just will, right, in order to really serve our families adequately.
Yeah. Thank you, Dr. Cooper. Lots of great feedback there, and well aligned with a lot of the themes we heard from our youth and family partners as well. So thank you. Carly and Brenna, on the point related to how do we really walk with our families and our youth when navigating what is a really complex system, even just getting on the phone with them. I know there were some good feedback related to that in your conversation. So anything you want to highlight from the youth and family feedback on that piece?
Yeah, I just want to highlight that, really listening to the family and to the youth about like what care are they wanting. And then just making sure that they get the support to get that. A lot of feedback we got was, the whole, I got a list to call and then I was on my own. And, got a list and nobody was currently taking my insurance, or nobody would take children with my child's exact diagnoses, or, whatever. And that really just, somebody to help with that portion was huge for families, because, they're trying to live their life, work their job, take care of their kid 24 hours a day, and then do this on top of it. It's just too much.
Yeah. Thank you, Carly. Brenna, anything you want to add to that?
Honestly, the feedback from the youth and just keeping it simple for them to understand, especially when it comes to like their plan, having that one person that can keep them updated. I think also it's important to point out, like, you have to build trust with the youth, and, like having like the simplicity over everything and that emotional safety. And then, like, youth nowadays, we want to text. So like even like incorporating texting into that too was a big thing.
Mm-hmm. Absolutely. No, that's spot on. And Carly, I appreciate that. That's something that we have included really specifically in the contract for the specialty plan, and related to the provider directory and making sure it's up to date. And we had a great suggestion of how can we make it feel a little bit more like Google Maps or Yelp, when you can indicate this information's actually wrong, right? They're not actually accepting new patients, or this phone number doesn't work, right? How can we really build some of that really user-friendly technology into the way that we connect folks with services? But thank you for that feedback as well. It's really helpful. Dr. Cooper, I also don't want to lose sight of your good feedback on the data sharing, right? How do we ensure that there's a system that folks can access, that where all of that information is centrally located? I know we have a number of folks on this call right now that are providing care coordination services right now, so we'd love to hear from you on what's been working well in the data systems that you use. What would be helpful in terms of resources or new ideas? We'd love to hear that. So we'll have our email that we'll share as always at the end of this presentation, and feel free to don't hesitate to reach out if you have ideas and suggestions. That's something we're in the very early stages on our end, and we'll be bringing a lot of ideas to this group, but we'd love to learn from folks that are doing it right now on how best we can do that. So thank you. I appreciate that. Grace, I saw your hand.
Oh, hi there. I don't know if this is the opportune time. I did just have kind of a small statement of input, but if it's
Please.
better if I wait till the end, just please let me know. Yeah.
No, go right ahead.
Okay. So, hi, I'm Grace Larkins, and I just wanted to kind of publicly state that given the core tie here with ADA and the Olmstead Act, you know, I'm expecting that there's going to be a strong component related to that population of youth with disabilities, including neurodevelopmental, intellectual, and complex medical needs. So both professionally and personally, I have really deep ties in that parent community in this area of children with disabilities. And so I really see a great deal of mental and behavioral health crises, and parents who are, some really living in fear and have very little help when their child is deemed too high a level of care. And so, I'm, and I want to point out also that I'm not being accusatory. I actually really want to celebrate everything that y'all are doing here. I really see so much progress, amazing input, amazing people. This is a really important project, and it's very, very exciting that what y'all have done so far and where this is going. But and I have not been present at enough of these meetings because I'm kind of just joining in. This is only the second time I've been here, but I personally haven't heard as much addressed in that area as I would have expected. So I, again, just really appreciate what all you're saying, all of the work that y'all are doing. But I wanted to point out that real dire need for those families and children that are at that intersection.
Yeah, absolutely. No, thank you, Grace. I'm grateful that you're here. And yeah, Carly, go ahead.
Sorry, I just wanted to add, thank you so much for bringing that up. That's a very important point. Knowing Nevada PEP and what we do, how we support families with children with disabilities, including mental health, a lot of the families that we spoke with are families of children who have both. And particularly the focus group that we held in where we talked directly to families, I believe every family in that was a dual diagnosis family.
So, well, that's fabulous. That is great to hear. And I always appreciate the work that you do at PEP. Y'all do. We send people to y'all all the time. So love your work. One question that I have is the waiver. What about the Katie Beckett population? Would there be kind of, given that in the eligibility list, I see that there's children with the behavioral health disabilities and children who are at risk for developing a behavioral health disability. So that intersection there is so high that I'm curious if there is any chance of that getting folded in at all.
Absolutely. No, thank you for raising that, Grace. It's definitely something that we've heard from others as well. we're working right now with our kind of national expert partners as well as CMS to figure out from a regulatory perspective how we can do that. It's a little bit more complicated because the front door to the system for Katie Beckett, as you know, has a different regulatory landscape. And so it's not going to be part of our phase 1 or the January 1st, 2027 population, but we're working hard to figure out how we can incorporate kids that are eligible for Medicaid through Katie Beckett later on. So definitely a priority for us, and we'll look forward to working with you through that. And we're trying to take the time on our end to figure out how we can pull that off from a legal perspective. So thank you for raising it, and definitely share that focus to make sure that kids get access to the care they need. So thank you.
Thanks, y'all.
Absolutely. I want to acknowledge that we are getting close to time, and I want to make sure Dr. Pebbles has a great update to really lead us into our next month's meeting. But we do have a couple hands up. So I want to turn to, I think, Natalie first, and then Katie, welcome your input here. And then folks that are chiming in the chat, if there's other things you want to add, we welcome that in the chat. We will note those, and we can follow up with those via email as well. So Natalie, I'll turn it over to you.
Great, thank you. I just wanted to give a quick echo to what you all had found at that summit. I've been getting calls for the last probably 2 months. At Health Psychology Associates, we've been providing testing for folks in Vegas as there's not enough Medicaid providers, and we've been working to get transport and figuring out all those extra things, and then also trying to do that care coordination from a different part of the state. So I'm really excited about this and where you all are headed with that. So just a big thanks.
Thank you, Natalie, for all the work you and your team are doing in multiple corners of our state. Really appreciate your dedication to our Medicaid patients, and look forward to hearing things that you're learning about those, consistent barriers and challenges and ways we can really work to improve that. So thank you. And Katie, welcome. We're glad to have you.
Hi, my apologies, you all. I ran straight from one meeting out to my car to join on this one, and I'm not usually on Teams via my car, so my apologies. So I focus on the autistic community, and we are seeing so many families who are in desperate need of support. So, for example, removing identifiable details, of course, that I had a family where the young person's autistic, and as you get a little bit in towards the teenage years, began to be quite aggressive with one of the parents, to the point that the young person was arrested for domestic violence. Now, to be clear that the mom had talked to us at length about these concerns, and we had reached out to the regional center, we had reached out to basically everything we could find, and they were repeatedly denied eligibility from this regional center. They had essentially, we contacted everyone we could, and we could find no one to help the family. And the concerns escalated, and of course, eventually ended up in the young person being in jail. This is just one case of many, and we really are desperate to even know where to send these families, because they ask us, what do we do? They say, we will spend every penny we will have, we will do everything possible, we will move out of state. They are so desperate for support, and at every door there's just nothing. Everywhere they reach a block. So really interested in what we can do to support them, and especially as we move forward, because we do need somewhere to send these families.
Thank you, Katie. I appreciate you sharing. And I'm just deeply saddened to hear that story. I know that's many on the call can share very similar experiences as well. It's something that I hear the desperate need, and know that we need to do better for kids that are living with dual diagnoses in this way, and better supporting these families. So want to call out kids that have dual diagnoses here of intellectual or developmental disabilities, as well as behavioral health disabilities, are eligible for this specialty plan that we're building. We recognize that the support that we need to provide these kids and families is going to look different than it would for other children in our system. And so really look forward to your feedback on what that care coordination flavor can look and feel like specifically in these instances. And so know that we're working hard, particularly in partnership with our colleagues at ADSD, to really figure out how can we improve the services that kids have access to, and improve access to the services in the first place. We all share the focus. I wish I had something to fix it with right now, and I know we all feel that way, but I really would love any ideas and input that you have in the short term and throughout each and every one of the policies that we bring to this working group. I'd love your feedback to make sure that we're doing right by these kids and their families that really need the support. So thank you for being here and for sharing that. I really appreciate it.
And we really appreciate your efforts. I think these families are really desperate. They are on a timeline too. And so one of the challenges is, of course, we want to do something, but I think we all find ourselves saying like, well, there's nothing we can do now. And in the meanwhile, these kids are progressing from a challenging situation to ending up in long-term institutionalization or in prison.
Yeah, absolutely. I appreciate it. One final thing I'll note before we turn to the end of our discussion, for any kids that are Medicaid eligible right now, regardless of whether they're also accessing waiver programs, et cetera, we have a specialized team that actually my colleague Michael Gordon leads that provides care coordination services and support for kids with behavioral health needs right now. So if you have any questions and if they're eligible for Medicaid, please don't hesitate to reach out to our Medicaid district offices. That's on the back of everyone's Medicaid card. It's available, information is available online, but we have a specialized team that's working to help navigate the existing system while we work to improve the system that we're building long term. So Katie, please don't hesitate to reach out there as well. And feel free to shoot an email even to our children's behavioral health email and we'll get it to the right place. So thank you. All right, with that, I want to ask for your patience to stay on for just a minute or two longer if we want to move to the next slide. In wrap up, we will be turning to already look towards November, which is hard to believe. So if you want to move to the next slide here, I'm excited to turn it over to Dr. Pebbles, who has some exciting updates to share on our screening tool summit and discussion. So Dr. Pebbles, turn over to you.
Thank you. So thanks a lot for staying on. In respect for your time, I'm just going to make it really brief. So we're going to have a summit essentially similar to the one for the youth where we garner your feedback basically on screening and assessment. So part of our DOJ settlement is that we have to come up with a set of screening tools, and there's certain kind of parameters that we have to stick to, of course. And so you will be getting an email relatively soon about what days you're most available, what times of the day, and some just background information on what screening tools you've used before in the past, which ones you might use currently, and which ones you might recommend that maybe you're not utilizing or had utilized or would like to, just so we can get together and talk just a little bit about it to make sure that we're taking everything in consideration, perhaps what you already use, so we don't create any further burden on you. But basically, it's about screening and assessment to make sure that we take in the needs of everyone, whether that's rural or detention or any other environment that kids are taken care of. So please look out for that email, and I look forward to speaking to all of you a lot more about that to make sure that I get your feedback in entirety before we then send that to the final steps, which is to CMS, the DOJ, the state, and an independent reviewer who will then finalize whatever selections everyone comes up with. And then we'll go ahead and, of course, get that to the public once we know what those set of tools might be. But again, please look out for that email and feel free to contact me as well if you're unable to attend and wish to provide feedback.
Thank you, Dr. Pebbles. A really exciting body of work, and you've been working hard throughout the past 8 months to begin the conversations with providers and community partners to really learn more. So excited to pull that all together, and particularly excited to learn more about that hypothetical patient case and how we can really test the case on some of these tools to figure out what can work best for the settings that we'll use them in here in Nevada. So look forward to all of that conversation and a lot more to bring to our working group to come. And with that, again, we welcome you to join us next month, Thursday, November 13th, from 4:30 to 5:30 p.m. As always, want to have over 100 people on a call for over an hour late on a Thursday afternoon is truly a gift, and we do not take that for granted. So as always, thank you for joining us. Before we close, we will turn it to a public comment period. I will stay on for as long as folks would like to share public comment, but want to thank everyone for joining. I truly appreciate it. So as a reminder, items can be raised here in public comment that are tied to anything in the agenda. Please state your name for the record so we can get that down for our minutes. And with that, I will open it up. Any public comment today? Yeah, James.
Yes, I believe in a previous meeting you had mentioned a pre-RFP conference that would go over the procurement and program in perhaps more detail. Curious if you had any more information on the timing of that event.
Yeah, thanks, James. We do not have a date set at this time, but keep an eye out on our listserv and on our website for more details there. We're finalizing that and look forward to sharing more as soon as we can. So thanks for your patience, but coming soon.
Thank you.
Absolutely. Any other public comment here? All right. With that, we will close. Thank you all again for your time. I truly do appreciate it. Have a lovely rest of your evening, and thank you again for a great discussion.